Hello everybody, this is Patrick.
And Abigail Murphy.
And this is going to be a quick demonstration of assessment techniques of the head, ears, eyes, nose, mouth, and throat. First we're going to do a little review of systems and ask some questions and sort of get a picture of how your health is doing and what kind of symptoms you're having. You seem like you're doing pretty well, so I don't think you have any symptoms, but we're going to ask anyway.
Okay.
So lately, have you had any headaches at all?
Only minor ones when I don't drink enough water. Otherwise, no.
Okay, any dizziness?
Nope.
Have you had any head injuries?
Sadly, no.
No head injuries, so you don't have any excuses then.
Not even one.
Do you have any lumps or swelling in your neck, anything like that?
I have just checked and it's a no.
Okay, any neck pain at all?
No.
Okay. Now, about your ears, you had any earaches lately?
Nope.
Any discharge from the ears? Anything coming out of them?
Oh God. Oh God. Actually, sorry, no. I wish I could be more medically interesting.
Okay. Do you ever hear any ringing in your ears?
Only when things are actually ringing.
Okay, like when the room is totally quiet, you don't hear any ringing in your ears or anything? Okay. What about the feeling like the room is spinning? You ever have vertigo or anything like that?
No.
How do you clean your ears usually?
With a Q-tip?
No, that's not a good idea. You shouldn't do that. The reason is when you put the Q-tip in, you push the earwax farther into your ear and it gets impacted. It's harder to get out.
Super.
Yeah. Don't put anything sharper than your finger into your ear.
My fingers.
Nah, you don't want to do that either.
No.
It's not hygienic. Okay. So, about your eyes. Have you had any pain in your eyes at all?
No.
You wear glasses, don't you?
Yes, indeed.
Are those just for reading, or do you wear those all the time?
Constantly.
Except for right now.
Except for right now, for your convenience. And the viewers.
Yeah, okay. Have you had any changes in your vision, like blurry vision or anything, besides how blurry it is usually without your glasses? No
it's remained fairly consistent.
Okay, good. Have you had any redness or swelling in your eyes?
No.
Any unusual tearing or discharge or anything like that?
Only at the sad parts of movies.
And you get your eyes checked regularly, right? You go to the eye
Indeed,
doctor.
I do. I have a lovely optometrist, Dr. Rappaport.
Yes. He doesn't call you kiddo, does he?
No.
Good. Doesn't call you pumpkin or anything.
No, that's only Dr. Bertman. That's only in the entire world, him.
Yeah. Mm-hmm. So about your nose, any unusual nasal discharge?
I had a cold a couple weeks ago, but it was all fairly usual.
Usual, okay. What color has your nasal discharge been?
Clear or white.
Clear or white? Any yellow or green or anything like that?
No, but I did have yellow, I believe the term is sputum earlier, with aforementioned cold.
Yeah, yellow is pretty normal. That's okay. Have you had any injuries to the nose?
No.
No injuries to the nose. Okay, good. All right, so what's next? Any changes to your sense of smell?
It's been consistently bad my whole life.
Yeah, any allergies or any allergic environmental allergies, anything like that, sneezing or anything?
No.
Okay. So how's your mouth feeling?
Within acceptable tolerance ranges, I could use a slight beverage.
Okay, good. No mouth soreness or any unusual lesions in your mouth or anything like that?
No.
Okay, you smoke at all?
No.
No, okay. How about...
Some of us are good kids.
How about your throat? Any throat soreness? Have you had a sore throat at all lately?
Only the couple weeks ago with the cold, but I am recovered now.
How about the teeth? Any toothaches?
Nope.
Anything like that? Your dentition is pretty good?
Oh, my dentition is lovely.
Oh, that's good. So what kind of medications do you take?
I take a generic Prozac substitute that starts with an F, and I take a...
Fluoxetine.
Fluoxetine.
Yes.
Yes, give the boy a prize. And extra credit. And something that's not Synthroid, but it's very much like it.
Levothyroxine.
Yeah.
Yeah. Okay. So how long have you been taking the synthetic thyroid hormone for?
Oh God, I can't remember. Bad memory. Side effect of hypoactive thyroid. Maybe a year? Don't know.
And how's your condition changed, do you think, since you've been taking it?
I am awake and alert more and for longer hours.
Interesting. So, why don't you tell us a little bit, while I glove up and wash my hands, why don't you tell us a little bit about your thyroid condition?
I have Hashimoto's thyroiditis, It's apparently an autoimmune disease. Before treatment, I had been known to sleep up to 20 hours a day. I would emerge to eat, use the bathroom, and annoy people, and then scuttle back into my cave. And then one day, my doctor palpated my throat. Go to the endocrinologist. And I did. And thus, a star was born.
So you've been going to an endocrinologist for a while?
Yes.
Yeah. And does she palpate your thyroid glands and stuff like that?
Basically, she just asks me questions, orders blood tests, and hands me drugs.
Okay.
It works for us.
So which doctors have palpated your thyroid gland?
Dr. Burtman.
Oh, okay. Well, good for him.
Yeah.
Yeah. He's a good doctor.
He was the first responder.
Yeah, okay,
so
good.
to speak.
So first we're going to examine your head a little bit. If anything I do hurts at all, please let me know. Go ahead and say ouch or just smack me upside the head. It's okay. Alright, so first I'm just going to generally feel your head and just make sure it's the right shape. Yeah. Alright.
You have a head.
Yeah. Smooth. There's no lumps or anything. That's generally about right.
I've forgotten the term for that pseudoscience. Oh, it was phrenology.
Phrenology, yeah.
And they thought that they could figure out personality traits from bumps on the skull.
Yeah, yeah. Alright, do you have any tenderness right here? Any pain?
Nope.
How about right here? Any tenderness right there?
Nope.
Okay, good. So I want you to look straight at my nose and turn your head to the left. Okay, now turn it to the right. Okay. Now tilt your head this way. Alright, good. And the other way? Alright, good. You try touching your ear to your shoulder on this side. Alright, now touch your ear to the shoulder on the other side. Alright, good. Now I'm just going to feel for some lymph nodes. Look at the nodes.
I've been assured I have several.
Oh, you have no idea. Okay. Alright, now I'm just going to feel some of these glands here. You got glands.
Yay.
Okay. Let's put these down here. Okay. Now for your trachea.
No, my only weakness.
Alright, go ahead and grab that water. I want you to take a sip of water. Do that one more time. Okay.
Sorry about the spillage.
And another sip. Yeah, that does feel a little big. Let me try this on the other side. All right, another sip. All right. Now let's have a listen.
Well, would the people you usually palpate have average, above average, or below average size thyroids, considering they're usually elders?
Above would be large would be abnormal.
Oh, okay.
Yeah. Normally it's hard to feel. Okay, so I'm going to set this to bell mode. No, don't make that noise. Come on. Just be normal for a second. As normal as you can be. Okay, all I'm hearing is the sound that your air, the sound of air moving around. Yeah. All right, let me take a look at your ear here.
Oh God, I'm gonna fail the test.
Is this tender at all?
No.
No. Okay, good. Now see the other one. You have a little freckle right here. Did you know you had a freckle on your ear?
Yeah.
Yeah. No tenderness or anything?
No.
Okay, good. Now turn that ear towards me, and then cover the other one up. Put a hole on it. Yeah, there you go. Push this thing in. Whole thing.
Yeah.
Seal it up all the way.
Mm-hmm.
I'm gonna slide back a little bit. Mm-hmm. All right, I'm gonna whisper 3 letters and numbers. Just repeat them back after me, okay?
3, 7H.
Okay, the other one? I don't know why I'm doing this too. I'm thinking of the eye test. Okay, now here's another one.
6VO.
Very good.
What unoriginal letter choices.
What do you
shame
mean?
the Murphy clan.
What do you mean unoriginal?
Oh, I saw
letter
those
choices?
coming a mile away.
Oh, jeez. All right. So now we're going to take a look inside your ear.
Okay.
It's funny that you choose to crack jokes right before the actual invasive part of this test comes up. Okay, so here I've got a disposable cover right here on my thing, which is called
Technical term.
Which is called an otoscope. Yeah. All right. So in order to do this, I got to pull up on your ear to straighten out your ear canal.
Yeah.
If you were a little baby, I would be pulling down, but
Okay.
I'm going to pull up because you're an adult.
Don't be ridiculous.
I'm going to pull up here.
Ow.
Oh, sorry.
Yeah, that was painful.
Yep, sorry about that. You've got some waxy buildup in there. But the eardrum looks intact. Oh, sorry. Okay.
Sorry.
All right, now the other side. Yep, nothing's inflamed. I don't see any holes in anything.
Yay.
Yeah, it looks good.
Much better on this ear. Points for improvement.
Thanks. All right. So next, the tuning fork. The textbook says that this isn't really a very sensitive test for general screening. It's sort of more something an audiologist does. But it's fun, and I like tuning forks, so we'll play around with it. So when you hear the tone get really loud all of a sudden, just raise your hand. Right about there? Okay. Right about there? Okay, it's about the same. Alright, now with the second one. The same volume, same pitch?
Yeah.
Okay. Now we can put this back. And now we can take off this otoscope thing. And put on the ophthalmoscope attachment. Now I'm going to re-glove because to look at your eyes I'm going to touch them, not the actual eyeballs, but I'm going to examine.
No, feel free, please. My eyeballs are your eyeballs.
I'm going to
so
examine a couple of things on your eyes. So
okie dokie.
Rewash and re-glove. You wouldn't believe how many gloves I go through in a day.
Well, I've seen the box in the back of your car.
Oh yes, lots of gloves in there. So re-glove. So you really don't get environmental allergies?
Well, I probably get them, but they're mild enough that I can ignore them.
You know, me and Mom are just crippled by them sometimes.
Yeah, so that's why I figure if I can ignore them or say, oh yeah, that's definitely a cold, then I figure they don't count.
So do you feel like your medication regimen is pretty easy to manage? It's not too much stuff?
No, it's only 2 pills once a day.
2 pills once a day. What time of day do you take the Thyroid?
I take both of them in the morning.
Before or after breakfast?
Before.
Before breakfast, okay. How far before?
It needs to be at least a half an hour.
Okay. Interesting thing I learned about the Thyroid is that you can take it late at night too, as long as it's like enough hours after
having
dinner.
eaten.
Yeah.
Oh, interesting.
But then that throws all sorts of problems into your late night snacking, right?
I do still love the late night snacks.
Yes, all right. So just look straight in my eyes here. Okay. So that looks good. All right. You got that. Yeah, nothing's swollen. Nothing's looking weird. Everything looks good. Everything's the same shape and the same color. That's always a plus.
Symmetry.
Symmetry. Symmetry is a good thing. All right. Now we got. Oh, yep. I got to point this end at you.
Point the light at the patient.
Yeah. All right. So just look straight ahead. Now this is really tricky because you're what? Are you nearsighted or farsighted?
I am nearsighted with astigmatism.
And I am also nearsighted with astigmatism. So this is getting the diopter to the right the right lens, it can be kind of a challenge.
But on the plus side, we become very close.
No, that's too far. There we go. And the ratio of arteries to veins looks pretty good. And I think I can kind of see your macula. That's good. It doesn't look like it's degenerating. So that's good. All right.
So I'm better off than Grandma.
Yeah. Now for the other one, my left eye is a lot weaker than my right eye, so this is a lot tougher for me. Okay. Alright, good. Looks like the other one just backwards. Of course, the arteries and the veins are all in different spots or whatever. That's okay. Alright, I'm going to put my glasses on now so I can see.
It was very difficult not to laugh when you were this far.
I know. Well, you know, you're supposed to be almost noses touching. It is tough. Alright, so with this one, we're going to do now. Yeah, back on that. So just look straight at the light. And I'm going to move it this way. Alright. I'm going to move it this way. And this way. And this way. And this way. And this way. Okay, good. Alright, now look straight ahead. Alright. Alright, good. Now for, where's the, okay, could you get your card? Alright, good. So I want you to look at the eye chart over there, about 20 feet away, the Snellen chart. Now let's use the fourth line, give me the third letter.
F.
F, okay. Now on the fifth line, give me the second letter.
C.
Okay, good. Now the other eye? Alright, on the third line, give me the fifth letter.
D.
And on the fourth line, give me the sixth letter.
G.
Okay, good. Alright, now let me have that for a second. I want you to look at the chart again and just keep focusing on it. Alright, good. Alright, keep focusing on it. Alright, good. Excellent. I have determined that you do in fact have eyes. Alright. So I'm going to re-glove again because I'm going to touch your nose.
Don't, it's too dangerous. You'll never escape.
And your nose, if I recall correctly, is not... I really got to get bigger gloves. These medium vinyl gloves are no good.
Yeah, you don't even have unusually large hands.
No, well, you know. Can you imagine? Can you believe there's actually sizes of gloves below this?
Well, I mean, I fit into those easy, but being female, my hands are probably smaller.
Well, there you go.
Poor Patrick.
But actually, it usually works okay. It's just right after I use hand sanitizer.
Makes it stick.
Yeah, it doesn't work quite as well.
Well, luckily, you almost never use hand sanitizer and then gloves, right?
No, I always do.
Yeah, no, that was where the sarcasm came in.
And, you know, we have latex gloves at work, but I never use them because...
Oh, yeah, latex allergies.
Yeah, latex allergies, exactly.
That's why the gloves I have in the kitchen, because raw meat grosses me out. Always vinyl, just in case.
Yes, always vinyl. All right, so I'm going to take a look at your nose and your mouth and your throat.
I have all of these things.
You do. So for this part, I'm supposed to use a nasal speculum, which is like a device to open up your nose.
Oh, yeah, to hold it open.
Yeah, I don't have one, so I'm just going to use my fingers
Okay.
and just take a peek inside, all right? Yeah, I see just some normal mucus in there. Yeah, that all looks pretty normal.
So should I get you a nasal speculum for Christmas?
No. There's no need for that. Nothing tender in here? Everything's
Nope.
okay. Normal. So by shining a light at your nose, I'm just checking to see if a light comes out the other side, because if you have a hole in your septum, that's what would happen. All right, good. Now, can I see in your mouth? All right, your tongue looks good. You don't seem to have thrush or anything. That's good. Okay, good. All right, just gonna open up. There we go, like that. Okay, good. All right, did we do the facial expressions already?
Not yet.
Okay, good. So I'd like you to smile. No, like really smile. That's a smile? Okay. All
I'm
right.
under pressure.
Okay, now how about a frown? And you shrug your shoulders. Okay, back down. Close one eye. All right, close the other eye. Okay, I think that's about it. Let me just double check and make sure I didn't miss anything. Oh yeah. Can I see under your tongue? Okay, those veins look normal. Okay, good. And then just slowly breathe out. I'm going to smell your breath. Okay. Well, that's about it. Do you have any questions?
No.
Okay.
Go team.
All right.